I have been in general practice since 1980. That comes up to be about 40 years. Prior to that, I graduated in 1973 from Mysore, India. And after that, I did 1 year of housemanship in India. And after that, finishing, I came to Malaysia and I did my housemanship in Negeri Sembilan in Seraman Hospital for 1 year. After finishing my housemanship, I was called to the armed forces and I served the armed forces for 2 years. Posted in Labuan, in Kuching, and then later in KL. After which, I left the armed forces after my term was over, and then I joined the hospital, that is General Hospital, Kuala Lumpur, and I was there for a couple of years before I came out and did private practice. That was in 1980.
Upwards, where were you based?
Okay, after I left government service, I joined the group practice, that is in KL, and I was with group practice for at least about more than 10 years with them. And then I started cleaning Anthony only in 1986. You know, I started cleaning Anthony, and until now I've been in this practice.
So means they say that you have been in practice with Clinic Anthony for almost 40 years.
Yes.
Reaching 45 years. Yes?
Yes.
Okay. For the next question, we would like to know your experience in wound care management.
Sure. Now my experience in wound care dates back during my army days. When I was in the army, that was during the emergency, and we were actually involved in evacuating wounded soldiers from the jungles, because at that time it was hot. You know, our jungles were hot. So there were a lot of people who were caught in booby traps. So our duty was to actually evacuate them from that area and then send them to hospital. Personal care on the acute cases we didn't have because we sent them to GH. But after care from GH, when they are back to our sick quarters, then we do wound care management. You know, mostly on these accident cases. Not very much on chronic wounds, but on acute wounds, which has been treated in hospital. So wound treatment at that time was not very exclusive or what we have today. You know, wound materials are a lot, wound materials are different kinds of wound material. Those days was not very much. You know, we have very limited wound care materials. So we managed with that, you know, and at that point of time, the healing was very slow. You know, we have to wait long time for healing, and then we have to see patients very often. Now that was the wound care management at that time. From the army days, when I left the armed forces, then I went into general practice. Now general practice, wounds in general practice are various kinds. Some are acute, some are chronic. This is where we see chronic wounds. Now acute wounds are mainly accident wounds, burns. You know, these are some of the acute wounds which we see. Infected wounds and things like that. But we also see chronic wounds like diabetic wounds, wounds due to varicose veins, venous wounds. These are also very common. And that is when my experience with chronic wounds started. Then again, you see, wound treatment, wound management at that time was limited. Not like what we have today. So much of variety of dressing materials, medications and things like that. That time was limited. So we were actually also struggling with chronic wounds at that time. Because wound management, chronic wound management especially, took a heavy load on doctors. And doctors sometimes not very happy treating them, because one thing is they don't get well fast. so you have to wait and wait and wait to get this wounds to be healed. Sometimes it may take months, sometimes it may take years. So sometimes doctors get put off by this. So that was one of the drawbacks at that time we had on treatment of chronic wounds. Acute wounds were normal, that's no problem.
For the next question, we would like to know, when did you started using Dr. Noor Tresor Wound Spray, and what is your experience using this with and the types of wounds that you have treated using Dr. Noor Wound Spray?
Okay, thanks. Now, here I would say that Dr. Noor's wound spray, I started using. I was introduced to this actually about a year ago. I think around that time, about a year. So I was actually introduced to this. Somebody came and then showed me this and said that it's very effective. I was very excited when I saw this product because one thing is it was so easy to use and it looked very simple. That is one thing. The other thing is when I saw pictures of wound recovery by using this product, I got very excited. I thought, why not? I try, because the wound materials we use at that time, now, it's one thing is they are very expensive, and the other thing is the patients have to come back frequently to do the dressing. That means every 2 days, every 3 days, sometimes every day, so it's very difficult on the patient to, if they are coming from far, so for them to come. But I must tell you that by this time we have already established a wound care unit in our clinic. So that's why we had ready-made patients, and when this product was introduced, I thought this will be the best for me to try something new, and that is how I actually took this product and I said, okay, I will try this product. I was very impressed with the response from this product which I saw in pictures. So I thought I'll give it a shot. Now the beauty of this product is it is natural. Many of these chronic wounds which we see, it was so difficult for us to use chemicals to treat these wounds, because some of the wounds like venous wounds and all that doesn't actually get well by using, they get worse when you use chemicals, creams, lotions and things like that. So sometimes doctors are stuck with not knowing what to use. There are new things in the market, which has come in, which we have been trying, but the results, I don't find it that very good, and most of them are chemicals. So when I found that this is natural, I thought probably this I would give it a shot, because it could be better than what I've been using before, and that is how I started on this. And what I saw, when I used this, what I saw, it was dramatic actually, because the healing, I could see healing taking place within 10 days. And I don't have to ask the patient to come regularly to see me. I can ask them to come and see me within 10 days or 2 weeks, just for a follow-up. Not necessary for them to come so often. So that is a plus point with this product, and I could see the changes in them. I've done many pictures and I've sent it all to the people who provided me this thing, and I think I've been very impressed with this product. From then on, I've been using it. Even I've used it on acute wounds like burns, operative wounds, when they come back, after operation, surgery, I've used, this product on those wounds as well. And I find it very, very good, if you can tell me. And I'm very convinced that this is a good product.